All right, so once we have got to know the mechanism of action of this agent, let's try and see what this drug is going to be used for. So the uses of this drug, we can use this drug to manage edemas, hypertension, and this drug too can be used to manage diabetic insipidus. The mechanism isn't that clear, but this drug is able to also be used in the management of what diabetic insipidus. And so that's the main use of this drug for treatment of hypertension. We can use this drug to manage edema. As we said, this drug is going to help us lose some form of sodium. And when we are losing sodium, water sometimes follows sodium. And if you have edema, your edema can subside with the use of this agent. And you can use this agent to also manage hypertension. This agent can be used to manage what we call diabetic insipidus. Then one thing about this agent is that this agent also offers some form of protection against osteoporosis in postmenopausal women, because we said this agent helps the body to reabsorb calcium. So the difference between these agents, or the thiazide diuretic and the loop diuretic, is that the thiazide diuretic will help the body to reabsorb calcium, and the loop diuretics will cause the body to lose calcium. With the thiazide diuretics, we are gaining calcium through the calcium channel, which is implanted at the luminal side of the early part of the distal convoluted tubule under the influence of parathyroid hormone. So we are gaining calcium. Then at the loop diuretic, what we learned yesterday was that due to the electronegativity that somehow exists between the thick ascending loop of Henle, it causes calcium and magnesium to also stay within the lumen, and we lose calcium and we lose magnesium. So that is what we learned yesterday. Now let's talk about their side effects. Let's talk about side effects. And almost all the diuretics that we have spoken about or we have studied will always lead to what we call hypokalemia, because all the diuretics will lead to loss of potassium. So in the early videos or in the early lectures that we did yesterday, we saw how maybe increase in sodium load will affect the principal cell of the collecting tubules. So at the principal cells of the collecting tubules, if I am permitted to maybe clean this and redraw the diagram a bit. So if we have this coming in here, then we have this. So if this is the principal cell of the collecting tubules, if we extend the cell a bit, so at the luminal side of the principal cells, we have sodium channels, and we also have potassium channels at the luminal side of the principal cells. So if the sodium load coming here increases, it increases the workload of sometimes the sodium channels over here. And if the workload of the sodium channel is increased, once we are taking in sodium at the principal cell, we are also going to lose potassium. Don't forget that at the basolateral membranes also, we have the sodium potassium ATPase that constantly pumps sodium back into the blood in exchange for potassium. And when potassium comes, we lose potassium through this potassium channel. So as sodium is brought over here, and chloride ions too are also brought over here, it creates some form of electronegative charge. So that electronegativity will help in pulling the potassium over here. Then we are going to lose potassium in the urine. So one side effect of this agent is that we are going to lose sodium, we are going to lose chloride ion, we are going to lose potassium ions. Then another thing is that the thiazide diuretic, like the loop diuretic, also increases serum glucose level, especially in diabetic patients. So when diabetic patients are taking or are giving thiazide diuretics, it is our responsibility to be monitoring their blood glucose level. It is our responsibility to be monitoring their blood glucose level because of increase in glucose level. Then the thiazide diuretics also causes, let me say, retention of uric acid that can lead to hyperuricemia and thereby can precipitate what gout formation. So with thiazide diuretic, its use can also lead to what hyperuricemia that can sometimes precipitate what gout formation. So if you are using this drug in patients with gout, then you should know that this drug can what precipitate what gout formation. So its use should be used cautiously in such patients. So this is what you are supposed to know with regards to thiazide diuretics, what they are used for, its side effect. So class, when you get to your lecture note, you go deeper and learn so many things have been what added to the lecture note. This is to make you appreciate what we have in the lecture note. Our next video is going to be on the potassium sparing diuretic. Our next video will be on the potassium sparing diuretic. So as a way of recap, the thiazide diuretic prevent the reabsorption of what sodium and what chloride ions, and we absorb what calcium over here. Then when we lose sodium, we lose chloride, we also lose potassium in addition to it. And we can use this drug to manage hypertension, we can use this drug to manage osteoporosis, we can use this drug to manage diabetic insipidus, we can use this drug to manage edemas. Then we have talked about their side effects. So we are going to discuss our next video, which will be on the potassium sparing diuretics. Thank you.